It has been more than a week since Russia invaded Ukraine, and a critical angle happening this morning is they are facing a mounting healthcare crisis with medical supplies running low. One of those particular cases is a children's cancer ward north of Kyiv, and this is a live shot we're showing you this morning of Kyiv. It's afternoon there. While the city is under siege, the hospital is running out of painkillers. These are for kids who are dealing with cancer. Those drugs essential for kids who are receiving their chemotherapy. Well, Dr. Dan Deckelbaum is a co-director of the Center for Global Surgery and Trauma at Montreal General Hospital. He's been working with hospitals in Ukraine since 2020. He continues to do so, and right now his team is trying to give phone consultations to Ukraine's doctors, and he is joining us from Montreal this morning. Welcome to Your Morning.
Good morning, Anne-Marie.
Once these consultations over the phone start with doctors, what will that look like?
Yeah, so it's first of all, I mean, I think that the Ukrainians have shown incredible strength and resilience during this time. It's an incredible tragedy that they are going through right now. The Center for Global Surgery has in fact been working in Ukraine since about 2010. And interestingly, we started our work in Donetsk and then expanded into Odessa, Kiev, and Lviv. During this time, we've been training teams to take care of trauma patients and injured patients in collaboration with their healthcare leadership. Obviously, in the last week or so, things have drastically changed. And with the Steinberg McGill University Simulation Center, we've been creating platforms for educational platforms and training for physicians in Ukraine to better provide care for the injured victims. So, for example, they have excellent physicians, but if you're a dermatologist or a cardiologist or a family doctor, you may not have ever taken care of a trauma patient. So during this time, what we've done is we've created educational modules for them that they use in order to provide life-saving care for the injured victims. At the same time, we've offered them telehealth live support as they care for the patients. And we've established a global coalition of healthcare leadership across Europe, Australasia, North America, to provide this type of support.
Just incredible, Doctor, what you're able to do from so far away during a crisis like this. You've been in constant contact with doctors there since the invasion. What are some of the challenges that they're facing? What stories are they telling you?
Yeah, so interestingly, as you mentioned, we've actually worked closely with Ahmadit Pediatric Hospital that you mentioned, with the Kiev Emergency Hospital, and they're struggling. They have an increased very high load of patients that are coming in. They don't have access to the normal resources, including material resources, human resources. But I must say again that they have shown incredible resilience and strength and dedication to their communities. And the Canadian Ukrainian community has done the same in supporting the work back home for them in an incredible fashion.
Doctor, what about some of those images that we were just sharing with our viewers now, which is the hospital wards that have been moved down to the basement because of the airstrikes, because of the shelling that's happening? I can't imagine trying to provide care in circumstances like that.
It's tragic to see that. There's no question that hospitals should not be going through these types of struggles, and it's very difficult to provide care in these types of situations. There's surgery that needs to be provided. There's intensive care that needs to be provided, and you can see from these images that you're showing that this is extremely difficult to do so in an efficient fashion in these types of settings.
Dr. Deckelbaum, I want to thank you for coming on Your Morning today, for the help and the care that you're offering to Ukrainians, both through their medical service and your colleagues serving over there as well. Thanks for being with us.
Thank you for the time.
Hey, thanks for watching. If you liked this, be sure to subscribe here, or you can check out more Your Morning videos right here.